gender-based violence cases, while the northeastern region tails the list, recording the least number of cases. Ministry of Health, in its very first gender-based violence prevention and response scientific conference at the Kenya School of Government in Kabete on Wednesday, noted that fighting gender-based violence is a collective responsibility. Charlene Mwende with more details.
Is a conference that was graced by the Chief Administrative Secretary for Health, Mercy Mwangangi, the main ideology being putting to an end gender-based violence.
The World Health Organization defines GBV as any act of violence meted to an individual based on their gender that results in physical, sexual, or psychological harm or suffering. It includes economic deprivation and isolation, which may cause imminent harm to the safety, health, and well-being of an individual and the society at large.
Traditionally, gender-based violence has for the longest been thought to be a ladies' affair, but Susan Mochache, the Principal Secretary for Health, debunked the proponent, stating that gender-based violence cuts across all borders.
When we think about GBV, think about an individual, a person, and that's a child, it's a woman, it's a man. That man who also will be raped, who will also suffer physical violence, because the issue of men and gender-based violence sometimes is not talked about, but it is within the scope of our discussion.
Also from the research released by the National Crime Research Center, the statistics show that Western Kenya is leading in gender-based violence.
GBV is most common among women living in Western region. That stands at exactly that 7%. Nairobi recorded that 5%, Nyanza that 4%, Eastern 25%, Central 21%, Rift Valley 20%, and Coast 19%, and least common among women in the Northeastern region at 6%.
Kenya will now be enjoying support from the United States of America as well as Finland in curbing gender-based violence cases.
As Finland, we want to find ways of using tech and innovations to address GBV. There are already good examples of this. For example, the Komesha Duluma mobile application here in Kenya. In Finland, the Finnish Institute for Health and Welfare, together with the Police University College, the one that trains the police officers, a few years ago developed an online course modules for duty bearers for their training in identification and response to GBV.
The administration of President Biden and Vice President Harris have made advancing gender equality and equity a priority. And PEPFAR, the U.S. President's emergency plan for AIDS relief, is increasingly focused on preventing sexual exploitation and abuse as part of the U.S. Embassy in Nairobi's gender-based violence priorities.
The Ministry of Health has now established parameters to mitigate gender-based violence cases, including the launch of documents on prevention and response to gender-based violence-related cases, and to ensure that they are dealt with the gravity they deserve.
The PRC kit, the post-rape kit. One, again, in my discussions with Kizi, in my discussions with magistrates, a tool, again, that's is so fundamental. Advised Health Facility Register, that's the MOH 365. Again, it's going to collect individual level data. It's going to be done daily, again, with regards to GBV care. Training curriculum on the clinical management of sexual and gender-based violence.
Thank you so much.
And a section of youth from Kibra in Nairobi under the Peace Prize Youth Coalition have embarked on a journey